Yeah, so the idea of using cells to treat diseases in cardiovascular disease is around, let's say, 22 years old. This cell, the CD34 cell, was actually one of the first cells to be discovered that has the natural ability to do something therapeutic in patients with heart disease. In fact, the CD34 cell is, I like to call it the pre-installed repair kit that the body has for building new blood vessels. It's part of nature's toolbox. So we didn't invent these cells. We simply discovered that they existed and that we could utilize them therapeutically by concentrating them in areas of the body that needed to develop a better blood supply. That makes these cells unique in the universe of cardiovascular cell therapy. There have been a lot of things that have been tried in heart disease, but none of the cells that have been tried is actually naturally suited to the purpose that they've been applied. This is the naturally occurring cell, and we're just leveraging that natural biology to do what nature installed these cells to do in our bodies. Well, so this is the sixth condition in which these cells have been tested. This study that we're reporting at this meeting is the first time that we have results. But other conditions, refractory chest pain in patients who have blocked arteries, heart failure, critical limb ischemia, that's limb-threatening ischemia, pain in the legs from walking, congestive heart failure. The cells have been tested in all those conditions, and again, unlike I think any other cell therapy that's out there, the cells have an unblemished track record. They always show or have been shown to be safe, of course, it's the patient's own cells, but they also have very consistently shown evidence for clinical benefit. So now that we have an indication that these cells work in CMD, the next step will be to do larger randomized trials to further establish the ability of these cells to really result in a permanent improvement in the patient's condition. And that's the other thing that's worth mentioning here. The CD34 cell has been tested in all these other conditions, but always with a single administration. So think about that, and we followed some of these patients out to 4 years. Patients get one dose of cells 2 years, 3 years, 4 years later. In studies where they've remained blinded to treatment assignment, they're doing better than the patients who were assigned to the control group. So there's something really substantial that happens to the patients. I look at it as turning the clock back on a disease. Cardiovascular disease we think of as progressive. So it looks like we found a way to turn the clock back and bring the patient back to an earlier, better stage of health. That's what we've always intended to do in medicine. This is a chance to really do it.